Hi, I'm Alex Mitchell and I'm the creator of Cancer Stories. Cancer Stories is a video diary program which is designed to help people like yourself manage their cancer. And the key aim is to record previous patients' experiences, really a wide variety of cancers. And these are patients who are genuine, real patients from Leicestershire who've given their consent to allow us to record their story onto DVD or the internet. What we ask those patients is really to give a brief account over 30 or 60 minutes. How did they manage with their diagnosis? And hopefully by watching their account, you'll be able to pick out some common themes from one or more of those videos. And those common themes might be things like what resources are available locally or nationally, or how do families cope, or how do people themselves manage with those awkward stages, either the initial diagnosis or the complications of treatment, or perhaps psychological and emotional complications, which are sometimes overlooked. So overall, we hope that by watching the video diary program, you'll be able to take some positives from other people's accounts, and hopefully that will help you better cope with your situation, whatever that is at the current time. Thanks for watching.
My name's Deborah Harper. I was born in Leicester, Wigston. I am one of 3 children. Lived at home with my parents. I went to all the local schools. After going to school, I went to a further education college where I did a business study course. And lots of typing exams. After finishing there, I went on to work for local government for 11 years. I left there when I had my first child, and I have 2 children, Paul and Natalie. Whilst my husband looked after my children at the weekends, I then got a job at the Leicester Royal Infirmary as a care assistant. And then when the children were old enough, I went back to work full time, working for a group of care homes, doing administration. And when one of the homes that I was in was taken over, they moved me to the head office where I ran the payroll department. I was there for quite a long time, very, very stressful job. But unfortunately in 2010 I had a breakdown due to changing medication and things. So I was off work for a year. Just as I was picking up, I was then had problems with symptoms with my breast. I went to the GP. They told me it was an age change, so I accepted that, but 9 months later things were getting worse, and I went back. So they sent me to the hospital, where I had all the tests done, and that was in 2011 when I was diagnosed with breast cancer.
Debbie Harper's come in today. Thanks for joining us here. and I heard your initial description that you've been diagnosed with a breast cancer, and it's kind of you to come in and tell people about it. One thing that strikes me is that initial delay, I think about 9 months from when you had your first symptom to when you actually received the diagnosis. Looking back on that, what actually happened during that time? What was the cause of that slight delay?
The GP at the time thought it was an age difference in my breast, but unfortunately the symptom that I had was really a classic symptom of breast cancer, but I just sort of trusted the GP.
Yeah.
And as time went on, the symptoms got worse. And I let it go on a little while because, I'd already been to the GP, but I thought I'm going to sort of get this checked again. And I saw somebody different, and they actually sent me, they referred me to Glenfield Hospital.
I see. And then how long from that stage until you received a diagnosis?
It was 2 weeks from there.
So you went into the 2-week wait period,
I did, yes.
Which is the UK guidance on seeking help.
Yes, that's correct.
Cancer is suspected.
Yeah. But I was seen before the 2 weeks.
Yeah.
I think that they're very good at Glenfield. To be honest, they do tend to see you before the 2 weeks is up.
Right. And you mentioned this symptom that you had. What symptom was it? Because it might be something that people will be worrying, is this happening to me?
That's correct. I had an inverted nipple, which I'd never had before in my life. It sort of just came on, which was a very odd thing for me because, I'd been perfectly normal before. It's
slightly more unusual than a lump or bleeding from the breast. It's one of those things people might not be so aware of.
That's correct, yes.
But you now know it is a possible sign if you have that.
Yeah, definitely.
Okay. Then looking at your care as a whole, the whole care you received for your breast treatment, do you think your care was reasonably well delivered? Are you satisfied with the care you received?
I have absolutely fantastic. They have the Glenfield Hospital, the breast care nurses, the consultants, amazing. They are amazing, and they are there. You can access them, through the day, Monday to Friday. There's a phone line that you can ring if you worrying, and you're never a nuisance to them. They're amazing people.
That's great. Can you describe the process that you went through after that initial referral? What happened through the treatment process?
I went on a Thursday, which was the 21st of December. I first of all had a mammogram. Then I had to wait to have an ultrasound. And then if they find something, I was examined before I had the mammogram, and the doctor marked the spots that they thought were sort of, not normal. Yes. Then I had the mammogram, then I had an ultrasound, and then the biopsies. After the ultrasound, unfortunately, I had a little bit of an upset there because the person that did that sort of virtually told me I'd got cancer there and then.
What did you think of that? Because
I don't know whether you've seen that advert on TV where somebody's been told they've got cancer and they just fall on the floor. Well, that is just how I felt. That advert is absolutely spot on.
Yes.
And I was devastated. But I think that news was delivered to me very wrongly at the time.
What would you have preferred?
I would have preferred to have gone and had the biopsy done first, and then taken into a room and had somebody explain it to me properly, rather than I sat up and the radiographer sort of said, right, I'm really sorry, but I found something, you know, and we think it's going to be cancer, but you've got to have the biopsies first. And I thought, you know, I think they should have delivered that in a room somewhere else, because they wouldn't even let me bring my sister in after they'd told me. They made me just sit there. And I thought, no, that's the only bad thing that's happened, you know. And I feel that news should have been delivered to me with my sister at the side of me.
Yeah.
In the quiet room.
Was your sister there on that?
She was.
But she wasn't
with
there
me.
in the room on that.
They wouldn't allow her in.
Okay.
They wouldn't allow her to come in.
What was the next step then in the treatment process after the diagnosis was made?
After the diagnosis was made, I had to wait a little while because it was over the Christmas period. And then I was called back to, they sort of let me know exactly what I'd got and what was happening. They explained to me that I'd got multifocal cancer, which means that it's in more than one place. So I had 3 tumours in my right breast, and also I had precancerous cells in there as well. Fortunately for me, they were all low grade, but I wasn't given a choice. I had to have a mastectomy. So that was organised, and I went in on I think the 18th of January. And I had my mastectomy, and again the care was amazing. You could not fault anybody at all. Very well looked after. And then basically they let me out. The following day I went home. And then after that, I had quite a lot of seroma keep coming in to the wound. Well, they send you home with a drain, first of all. And then that's obviously taken out after a few days with a nice little handbag to carry it around in. And when the drains was taken out, I started to get seroma, which is quite painful, because it all sort of swells up, and it makes all your skin really tight. But there's a fantastic seroma clinic at Glenfield where you can go along and have it drained away on a regular basis if you need it. And then I was referred on to the oncologist, who decided that I should go for chemotherapy and radiotherapy.
Right.
Because I'd had some lymph nodes involved. They took 3 lymph nodes, and 2 out of 3 were infected with the cancer cells. But instead of actually having a clearance of lymph nodes, I went for radiotherapy to my armpit, because I didn't particularly want any more surgery. But they said you either have one or the other, and it works exactly the So that's what I went for, because it was sort of less invasive, after already having had a mastectomy.
Were there any other options given you? I'm thinking maybe reconstruction on that side.
I was offered reconstruction, but it's my personal preference not to have it, purely because I want to know exactly what's going on behind the reconstruction or behind the skin.
Yes.
And I'm always a bit scared that you don't know what's going on behind it. And the other thing is, providing, your husband and everybody concerned is quite happy with the way that you are.
Yes.
The prosthesis that they give you is very, very good, really. As long as you get the right underwear with them and everything, for me personally, it's not for everybody, but I find that adequate, and it doesn't affect my life, with my husband or anything else. So that, that's also, I know a lot of people that have had reconstructions that have said that if they'd have known what it would have been like, they wouldn't have had it done. But everybody's different, and I think that's a personal thing that you have to decide for yourself. I think a lot of it is how you feel,
Yeah.
But you don't have to decide there and then. You can go back years down the line and ask for it if you're not happy.
Exactly. What happened next regarding the chemotherapy?
Right, I started my chemotherapy. I was very, very nervous, very, very anxious. The thought of having the chemotherapy made me quite ill, actually. Out of all the treatment that they were giving me, I really had a thing about not having it, I really didn't want it. I had my first lot, and I think it just went on how it was supposed to. That they explained what would happen and at the different weeks that you go through with it. But when I came to have my second lot, my blood count was too low for it. So I had to start having injections to boost my immune system, so that I could carry on having the chemotherapy. So they just took the bloods, and as long as my immune system the levels were high enough, I could carry on with it. But the second one I had absolutely wiped me off my feet, and it made me very, very poorly. I went back to the oncologist, and he was asking questions, and he said, I think we need to stop this because the
side effects
are outweighing the benefits.
Yeah. Did you agree with that? Because that's a difficult decision.
It was a very, very difficult decision, and the problem is it wasn't my decision. And I did say to him, I'm frightened because, I'm not getting all my treatment.
Exactly.
It was very, very frightening.
Yeah. Because you probably wanted to complete.
I did. I wanted to complete everything they offered.
And what did he say to that?
What he suggested was that they ablate my ovaries with radiotherapy, which would stop them working because my cancer was estrogen positive. Then it would stop the flow of estrogen.
Yes.
And that, in effect, would be the same benefit as having the chemotherapy.
Yes.
So, although I was a little bit nervous about it because I still hadn't had the chemo. Eventually I sort of managed to live with that. And then I went on to the radiotherapy. I had 25 sessions, which you go for Monday to Friday. And I had radiotherapy to my armpit and the area of mastectomy. The most that happened with the radiotherapy is obviously you feel very, very tired with it. And I look like I've got a nice big patch of sunburn. I blistered quite badly towards the end, but they give you plenty of things to combat that, you know, creams and things. But generally, I tolerated the radiotherapy very well. And then I was given 5 years of tamoxifen. And after that, the oncologist said that they would put me on another drug after the 5 years. I think, I'm not 100% certain, it's called letrozole.
Anastrozole, is it?
Is it anastrozole?
Or is it letrozole?
I think it's letrozole. I'm sure it was an L.
It could be.
But that helps to guard you for another 5 years.
Yes. And did you have that procedure for the ovaries that you mentioned?
I did have that procedure for the ovaries. Unfortunately, it's caught my bladder as they were doing it.
Was it radiotherapy they were targeting?
Yes.
So there was a little bit of overspill to the bladder?
I think, yeah.
And what was the side effect you got?
Unfortunately, incontinence.
And that definitely came from that, did it?
Yes.
Did they warn you about these side effects?
They did. Yes, they did. But to be honest, I'd rather have had my ovaries stop. The incontinence side of things is not, it's not pleasant, but it's not a major issue, and things can be done.
Yes. Let me ask you about the period that followed those treatments, in particular how you were coping afterwards. And I know there was a complicating factor for you, wasn't there? And you mentioned it to me off the video, and I hope you don't mind me talking about it. It was the fact that you had a quite severe depression before the cancer was diagnosed.
Yes, yeah.
I think that was about a year before.
It was, yeah.
Do you mind talking about what happened in that year before, just in brief?
What happened was, I'd been not feeling very well. I've been on antidepressants for years because I've always suffered with anxiety and depression.
Yeah.
But it was pretty much under control, and I was under a psychiatrist, or have been for many years. Yes. For it. Because I wasn't feeling very well, and I'd been on my medication for a long time, the psychiatrist thought that maybe a change might be a good idea. But we tried to change the drugs, and it all went very, very, very pear-shaped.
Yes, so you didn't get on well with the new medication?
No,
suggested?
Not at all. And then I ended up in hospital for 4 weeks in the mental health unit at Glenfield, on the Heather ward at the Bradgate Centre.
Yes, I know the one you mean.
So I was there for 4 weeks, trying to sort of get the medication back on track. But unfortunately, it led to lots of things, this medication change. I even now don't leave the house alone. I always have somebody with me. Severe panic attacks, although they have bated quite a bit now. Severe anxiety attacks. It led to me having to give my job up, although I think that was part of too much pressure.
Was that the one in the payroll department?
Yeah, too much responsibility, and they were just putting more and more on me, and I couldn't cope with it anymore.
Yeah.
And I think it was a number of things that were happening in my personal life that sort of led me to feel poorly in the first place. And plus, I don't think the tablets were helping. But unfortunately, you know, it's left me in a bit of a horrible situation whereby I can't go out on my own. I don't drive my car anymore. I can't use public transport. So it's left me...
It's interfered with your independence.
Completely and utterly.
And that was the case before your cancer diagnosis?
Yes, it was.
And was your depression the kind that tended to come on out of the blue, or could you identify a stress or a trigger?
It comes on out of it. It comes. It just hits me like a ton of bricks.
And was it a pure depression, just depressive symptoms, or other? You mentioned anxiety.
I had severe anxiety.
Yes.
Terrible. I was on, and still am, on lots of medication for it.
Yeah. Did you try non-medication approaches?
Yes. Well, no, that's a lie, because I can't actually get off what I'm on.
Yeah. But in addition, maybe to the medication, did you have talking therapy?
Yes. I started CBT.
Yes. Cognitive behavioural therapy.
Yes. And I was having counselling.
Overall, how effective were those treatment strategies for your depression?
I think I was so far in it, it was hard, you know. I think nothing was really working at the time. But a long time ago, I could never do relaxation. I found it really hard. But I practiced and practiced and practiced until I found that that was one of the things that actually worked for me eventually.
Relaxation.
But it took a lot.
What kind of techniques did you use there?
I use I have an iPod that I download CDs onto the iPod.
Relaxation strategies.
Yes.
And is it the passive music type or the coaching type where they tell you what techniques to
Well,
try?
I've done both. And there's another one, isn't there, where imagery.
Visual imagery.
That is fabulous. You know, because it's lovely to imagine you going down to a nice beach with the water.
That works for you.
And it does for me. It doesn't work for everybody, and I know it's very hard to relax. And I could never do it for years, but I really, really made myself do it every day, 2 or 3 times a day, and that really did help eventually.
Now, how did that previous experience of depression complicate your recovery from the cancer?
Because obviously, you know, the being told that you've got cancer is a big blow to any person that are told that they have it. But the added complication is when you've already got depression and anxiety, it was twofold. It made it into a ginormous problem. And I found it very hard to cope. I couldn't sleep. But believe it or not, I didn't eat and I did lose weight. And the anxiety levels were absolutely horrific. Just the fear that I thought I might die, you know, this is it, I'm going to leave my children behind. What if it's already spread? You know, all these things go through your mind constantly. As time has gone on, you know, the anxiety levels have lowered. I was taking diazepam at the time to help me through. Not masses of it, but probably 2 milligrams a day or something, just to get me through the worst part of the day. But I find I'm not having to take that anymore.
Well, that's good.
And I've started to venture out a little bit.
So things are actually beginning to improve.
Things are starting to improve, yeah. And
even
plus,
compared to how you were before the cancer.
Yes, yeah. Plus, I've had great support from the psycho-oncology as well.
From the team, yes.
Yeah, I mean, the nurse that I have is fantastic, you know, and she supported me. Dr. Mitchell supported me, and you know, I've had a nice big support network.
Do you think that you have been able to make more progress since the cancer than before, in a way?
Definitely. Now all the treatment is out of the way, and I'm sort of a year on, or a year and a half on. Although I'm still, you know, I do still think about secondaries and is it going to come back, or, you know, I'm finding I'm managing to live my life. It's not all about cancer.
So some of those fears are in control a little bit.
Yes, but I'm not, you know, I'm still got a little way to go. But I hadn't left Leicester for 3 years. And I've just made it to Manchester to see my stepdaughter.
Well, that's great.
And I'm quite proud of myself for doing it.
So that's a symbol of you doing well, isn't it?
Exactly.
You can venture out and more further afield.
Yeah. The other thing is I took a lot of support from Breast Cancer Care. And they are fabulous too. I used to, because you can use their helplines, they have a chat on a Thursday night that you can join in.
That's great. Over the phone?
No, it's online.
On the internet.
So we're all, you know, you've got 2 breast cancer nurses and lots of people, and we're all chatting away.
Is it audio or typing?
No, it's typing.
Yeah.
And it's lovely, you know, because everybody's in the same boat. You can ask whatever questions you want, and the breast cancer care nurses answer you, you know, and because if you go on regularly, they know who you are, and that's really nice. But now I do fundraising for them. I've become a registered fundraiser because I've taken a lot out of it, so I'm trying to put something back now.
That sounds like a good idea, because that gives you also a role, doesn't it?
Yes.
And that's an issue if you've given up your previous work. You were saying about
that's right, yes.
The payroll job.
So
previously.
My next mission on the 28th of May, I have to get on a train with Richard, of course, not on my own. This is part of my CBT.
Right.
And I'm going, when you volunteer fundraise, you have to go on a course. So on the 28th, I've got to get on a train to Sheffield and go on this course.
How did you get to Manchester?
In the car.
Was that a bit easier, do you think?
No.
Okay.
Because it's motorway and I don't like it.
Yeah.
Because I feel trapped on the motorway.
Yeah.
There's no escape. You've got to wait for the next exit.
Yes, I see. Are you driving?
No, because I actually took myself off the road when I started having severe panic attacks.
That's probably wise if you don't feel confident.
And I was the most confident driver ever, you know, well, in my eyes. But I had a massive panic attack whilst I was driving.
Yeah.
And I had to pull over, and after that
You made a decision.
I made the decision that it's not right to be on the road, so I took myself off the road. I've not, you know, I've not taken my license, nobody's taken my license away, but until I feel confident and safe, I won't go in the car.
I mean, the guidelines on mental health and driving are a little bit vague, but the bottom line is if you don't feel confident to drive, whether that's through medication or an illness, it's best not to drive.
Well, I don't. That's what I mean. I haven't really driven free. I think I've driven around my dad's once, but it's all side roads.
Having said that, it's good to keep your independence
yes.
as much as possible
Yeah.
and not sacrifice that.
but I'm not at this moment confident enough to go out on the main roads without thinking I'm not going to, I'm not going to have a panic attack. So I don't do it because it's not safe for other people either.
Definitely. So let's think a little bit about what plans you've got for the future and what's coming up for you. Can you see some positives in the future?
Yeah, I have to say, I'd like to be, when I've finished all my CBT, I mean, at the moment, I don't feel like I can look for jobs at this moment because I'm still going through that treatment and I need regular times to go. And I don't think it's fair on an employer if I go back to work now and then I'm saying, well, I need this day off and I need that day off.
It's difficult to juggle that. You might wait till you're a little bit more in yourself.
That's what I'm thinking. But my aim is to actually go back to work because that's what I miss.
I can understand that.
I have worked from the age of 14. I have worked. Even when I had my children, I worked. I've never had time off work, even with mental health.
What do you think the main issues are when you would be considering going back after a cancer diagnosis and after a mental health issue?
My worry is that I'm not employable at this moment.
Is that down to what you feel your capabilities are?
No, I think it's the way today's climate, and there are so many people out there looking for work that are very well qualified, and
the competition is fierce.
Huge. And if I go in and I've got to put on an application form that I've had cancer and mental health issues, I'm, not going to stand a chance against somebody else.
So in that regard, do you think mental health or cancer in that respect has a stigma associated with it?
Definitely. Particularly mental health has a huge stigma. But I'm as capable as the next person.
What would you say to people watching this who find that difficult to understand and are saying, well, isn't everybody judged on their merits these days?
No, I don't think so. Mental health has always had a stigma attached to it, and that will be forever. That will never change.
I mean, one way for people watching to think about this is to think, if it was you with the diagnosis, how confident would you be about telling another person, a family member or an employer? If you'd be hesitant about it, it implies there's an issue with it. Do you know what I mean? There's a stigma out there in society that could cause you a disadvantage. I think things are changing, but slowly, slowly. Not every person, just like not every employer, is actually sympathetic and willing to take you at face value.
Exactly.
What kind of job would you be thinking of if you went back to work?
Well, there's a couple of things I've thought about. I would like to actually work with mental health because I feel that I have quite a lot to offer because I've had a lot of experience with different things, and I'd be quite interested in that. The other thing is, I've often said I'd be quite happy in a shop, behind a checkout or something like that. That's not
too stressful.
Exactly. But I think ultimately I would like to work with mental health.
Would you ever consider a voluntary role?
Yes, definitely.
Because that's a gentle way back into employment.
Absolutely, yeah, I would, yeah.
What issues do you think you're still facing in the future? Are there any barriers or problem areas you think I need to get on top of before I'm back to my normal self?
Well, going out of the house on my own is a major thing at the moment. And because obviously, if I do go back to work, I've got to get there and back. So that is my major issue at this moment. But that is the next thing to be tackled with the cognitive behavioural therapy.
Yes. So there's a few barriers there, but I get the sense you're still pushing yourself a little bit.
I have to, because nobody else does it for you.
I agree with that, but by the same token, is there anyone else around you who's actually on your side and helping?
Absolutely. I've got a very, very supportive husband. I've got a very, very supportive sister and a very supportive father.
So you've got some family support around.
Absolutely. They're brilliant. And a really good son and a daughter that have never brought me any trouble, and they support me very, very well as well.
Have you seen any particular issues regarding your physical health or mental health issues for the family, how they've managed?
I think it's been hard. Richard has somebody come round from the Rethink.
Yes.
So he can offload onto them. But it's very, very hard. I know how wearing it is living with somebody with mental health issues, even, and then getting a cancer diagnosis on top. You know, poor old Richard, I don't know how he's coped with it, but he gets his sort of release by having somebody come round so he can offload. And he's also very kindly gone along to on a course to learn about that Rethink run, to learn more about mental health and medication and stuff like that.
Well, that's great. That sounds like a useful resource out there if it's accessible.
That's right, it is, yes. So, you know, Richard does get support, but it is hard. It's very hard for the whole family, you know, because, you know, when you're actually in the pits, you're very needy.
Well, I was about to ask you, imagine the situation of somebody coming new to a diagnosis of breast cancer or another cancer, and they have a past history of depression. What would you say to them about how to manage the next few months or even few years?
I would access as much support as you can from, you know, like yourselves, psycho-oncology or whoever is out there to support you. Use breast cancer care. There's places like No Panic that you can ring. Just use everything that you can possibly use, because all these things are a huge support, and it does help you get through, you know, from day to day, because there are people out there. And I would just say, you know, just remember that we can be a little wearing on other people. So, you know, so sometimes we have to give them a break.
That's a fair comment. Well, look, I think you've come a long way with, you know, quite a complicated situation with that past history, and also things that didn't go 100% smoothly necessarily during the cancer treatment. So I want to wish you all the best for the future.
Thank you very much.
And I hope things continue to go well, and I hope you continue to improve, get out there a little bit, you know, to show what you can do now.
Yes.
All the best then.
Thank you very much.